All right, so this next session is a little bit of a different format. There will be 3 speakers bringing us 3 different perspectives on the topic of inclusive mentorship. And I will introduce the speakers right before they step up, one by one. So the first speaker will be Dr. Michelle Moniz, who's an assistant professor in the Department of Obstetrics and Gynecology here at the University of Michigan and a co-organizer of this event. She is also a health services researcher, and her research seeks to integrate evidence into reproductive health policy and clinical practice, and she is passionate about career development and mentorship with a particular interest in the professional advancement of women in medicine. Michelle.
Thank you so much. So I want to recognize at the outset that we're talking about a pretty nuanced topic, and we have decided to keep our comments pretty brief. So you'll hear a little bit from each of us, just kind of introducing some key themes. And when it comes to mentoring women and underrepresented minorities and millennials, and we want to make sure to leave lots of time for robust discussion at the end of the panel today. So start thinking of your questions and comments for us. So in academic medicine, gender-based disparities in outcomes are quite striking. We know that women have less access to mentorship and sponsorship. We continue to be paid less for the same work, and we demonstrate a much higher attrition rate from academic medicine, particularly at the highest levels of leadership. Some of the key challenges when mentoring women are listed for you here. First, combating both explicit and implicit biases. So assumptions about how women should or shouldn't behave in the workplace. Second challenge, particularly for men who mentor women, which may be quite common because 80% of senior leadership roles in medicine continue to be occupied by men. And so for many women, particularly as you rise higher in that leadership pipeline, the only folks available for mentorship may be men. And a particular challenge for male mentors mentoring women is thinking outside this box of your own lived experience at work. And recognizing that women may be perceived very differently for the exact same behavior in the workplace than a man would be. So with those background considerations in mind, my goal today is to leave you with 4 strategies that will set you up for success. So we'll go through each of these one at a time. So the first is to rewrite gender scripts. Gender scripts are stereotypes about behavior and gender that are very active in the workplace, and maybe things like the father-daughter script or the knight and damsel in distress script. And you may have subconsciously activated one of these as a mentor or as a mentee. And these scripts can be helpful to a point, but they can be harmful because they set women up as being portrayed as vulnerable, needing to be rescued and saved, and in unconsciously activating one of these gender scripts can lead to limitations on a woman's autonomy or hampering her transition to independence. So here are a few things you can think about saying to try to pull back from those gender scripts if you see them coming up. So this is a difficult situation, but I have confidence in you. What do you think your next move should be? So this is an example of a mentor declining to rescue a mentee. Let her rescue herself. Be the protagonist in her own narrative at work. If an assumption happens, it's fine to call that out. I'm sorry, I just made an assumption that you wouldn't want to speak at this event because you just had a baby. What do you actually feel about this? And then lastly, this is a challenging project so early in your career. You might stumble along the way, but this is a great learning opportunity. So setting things up that it's okay to fail. We don't have to protect you from failure. And in fact, missteps are a part of growing and learning. Second important strategy is to seek reciprocal learning. So research suggests that many women value collaboration and egalitarian learning environments. And these preferences may be quite at odds with our traditionally hierarchical, competitive, weed-out systems in academic medicine. We also know that women may be penalized for competitive individualistic behaviors that may be chalked up to confidence, assertiveness, great leadership potential in our male counterparts. Women may be expected to behave in a more communal way. And so a mentor who's mentoring women can coach a mentee to identify her natural leadership style, think about how it might be perceived, and hone it and tweak it for success. Mentors can also recognize that women may value egalitarian learning environments and try to break down that power dynamic. So you can try saying this: you have exceptional writing skills. I learned a lot from you in writing this grant. So this is recognizing a woman's expertise and acknowledging that this was an opportunity for reciprocal learning. Mistakes are part of learning. This one-time so a mentor is breaking down the hierarchy by engaging in a moment of vulnerability with a mentee. As my colleague, how would you advise me to proceed? So framing your mentee as your peer, as your colleague in this moment and asking for her advice is a very, very powerful way to engage in reciprocal learning. Third strategy is to up your emotional intelligence quotient, or your EQ. So we know that men and women are equally likely to experience emotions, but meta-analysis data suggests that women may feel more comfortable displaying emotions, especially in the workplace setting. There's also a really interesting study in which women scored significantly higher on all facets of emotional intelligence tested compared to their male counterparts. And we know that emotional intelligence is a key predictor of workplace success. And so while engaging in emotional conversations may sometimes feel uncomfortable, it's a really critical part of mentoring women, and I would argue mentoring men as well. So we can all get comfortable initiating and actively participating in conversations that explore emotions, and that frames these emotional moments as valuable and significant and not a sign of weakness or vulnerability. We can also interpret emotional moments as clues to a mentee's lived experience at work, which may be very different from your own as a mentor. And a mentor has a very important role to play in diffusing or elevating those emotions as is appropriate to optimize a mentee's success. So you can try saying, this may be difficult to hear, but I want to be honest to help you grow. Your grant is not where it needs to be. Let's discuss potential major changes. It doesn't help a female mentee to sugarcoat the feedback because you're afraid of hurting her feelings. In this case, expressing frustration might be counterproductive. How can we manage that emotion to get to your goal? So this is an example of acknowledging an emotion, acknowledging why it might be harmful to express it, diffusing it, and finding a way to use it in a more productive fashion. I value how carefully you are considering how this might affect others' feelings. So this mentor is actively framing emotional intelligence as a strength that this mentee brings to the table. Lastly, be an upstander, not a bystander. So upstanders are folks who advocate for gender equity at the organizational level. We know that many institutional policies, from those related to hiring, promotion, maternity leave policies, systematically disadvantage women. And male mentors and female mentors have an opportunity to try to make the workplace a more equitable place by working on adjusting those policies. We also know that in academic medicine, about 1/3 of female medical faculty report having experienced sexual harassment at work. The most common form of sexual harassment, to be very clear, is gender harassment, which is defined as contempt or hostility or crude behavior based on gender. It is not about sex. It is about disdain for women that permeates into culture and policies. And mentors can be a very powerful force to try to address those barriers that women may face in the workplace. So they can use their organizational and social capital to push for more equitable policies and make women's accomplishments more visible. So you can try saying this: our recruitment and hiring packages should be rule-based and non-negotiable. You can say she's analytic, decisive, fair, and a remarkably impactful investigator. I'm nominating her for division director. So you're sponsoring her, making her visible for opportunities. And you can also call out bad behavior when you see it. That language is dismissive and derogatory towards women. We don't tolerate that behavior in this department. So I'll leave you with these concluding thoughts. As in all mentoring relationships, it's critical to look for your own blind spots and seek first to understand, particularly when somebody's lived experience at work may be different from yours, and to recognize that the very best interpersonal strategies, many of which you heard about this morning in our first panel, that these may be inadequate if we don't begin addressing some of these unequal policies and the culture. I'll leave you with this quote from our former First Lady, Michelle Obama. A truly strong, powerful man isn't threatened by a strong woman. Instead, he is challenged by her, he is inspired by her, he is pleased to relate to her as an equal. Thanks for your attention. I'd be happy to answer questions.
Great, and we'll save questions till our panel discussion at the end. So thank you, Dr. Moniz. Our next speaker is Dr. Okeoma Mmeje, who is also an assistant professor in the Department of Obstetrics and Gynecology. And she has a research program focusing on treatment and prevention of sexually transmitted infections. And she's going to talk to us on the same topic of inclusive mentorship, particularly mentoring underrepresented minorities. Dr. Mmeje.
Good morning. So I'll be speaking to you all about mentoring underrepresented minorities. So the benefits of mentoring, I believe, have been discussed already, but I'll highlight that mentoring supports, develops, and retains talented individuals in your organization or your unit. It provides a positive, impactful experience, particularly for women and self-described ethnic and racial minorities. It gives them access to top leaders' thinking and their experiences and how they got to where they are. So they serve as a model for people to ascribe to. Again, for women and minorities who are underrepresented in top leadership, this is an opportunity for them to be advancing their careers. So I'll show you some information here gathered from Hendrick and Struggles. They evaluate professional organizations, and they conducted a national survey in 2017 of approximately 1,000 managers at top organizations. And they also did focus group discussions and in-depth interviews. And when asked through the survey, how important do you think having a mentor relationship impacted your career, approximately 27% reported that it was extremely important. And when you're looking at that subset, women and those identifying as minorities reported that they were likely to say that their mentoring was extremely important to their career development and growth. So this is an important thing when you're looking at underrepresented groups in the professional workforce. Again, when asked what kind of advice or support has your mentor offered you over the course of your mentoring relationship, 72% of the respondents indicated that they provided feedback that they found was strengthened and helped them grow in their professional career. And so this, again, highlights the importance of mentorship relationships, and you can see the other areas of strength were also they advise them on career paths and processes and development strategies that they can employ to advance themselves in the workplace. So there are a lot of important feedback that mentors can provide to underrepresented individuals in the workforce, and I'll just highlight some of the open-ended comments that were received from this survey. And the second one there highlights that mentors help them make the most of their strengths and help them to identify how to delegate the rest of other tasks that could be consuming. I think this was very helpful since I'm a do-it-all-myself kind of individual, and it really helped to hear someone tell me the importance of giving tasks to others who can handle it. And many of us in the workplace always feel as though that we should take on everything, take on more, and sometimes that may not be the best decision for you in order to focus on tasks at hand and be able to focus on your own career development and growth. So boosting diversity with mentoring. So diversity training alone may be detrimental to enhancing diversity. And this is something that came out of a study that was reported in the Harvard Business Review. And when diversity initiatives or activities are mandated, it found that there was about a 9.2% decline in the number of underrepresented groups in management. And I'll show some more information about that shortly. So in essence, diversity training plus formal mentoring can result in successful change. And formal mentoring usually has 3 specific components. It's goal-driven. There are steps and processes that are followed that help the mentor and mentee define how often they meet, what topics they discuss, and together with a formal mentoring program, you're able to support successful change. And when you engage managers in the goal of mentoring, in addition to diversity initiatives, you enhance their role in diversity and inclusion in your organization. So mentoring makes managers a part of the change by helping them know the workers of certain minority groups, which they usually have stereotypes and biases against. When we don't know others, we tend to work based on our preconceived notions, and that may be detrimental to development and growth of others in our workplace. So this here is an illustration describing how I would say forced or mandated diversity activities such as diversity training, job tests, or grievance systems may have actually negatively impacted the diversity in a workplace. And you can see the items highlighted in orange were actually negative impacts that forced diversity programs may have on a program. And then here, these are some diversity programs that may get results. So the ones that are highlighted in the darker blue or turquoise color are actually initiatives that were promoting diversity in the workplace. And so, for example, diversity task forces were beneficial for men and for women in advancement. And then others were college recruitment activities and volunteer training. And so engaging individuals in a voluntary basis for diversity initiatives also helps promote growth and professional development of minorities. So some other successful strategies to enhance diversity, again, engaging the managers in problem solving. Dr. Moniz alluded to this already, and then this helps them begin to think of themselves as diversity champions for the initiatives in your unit. Exposing managers to people from different groups, encourage social accountability for change, and cross-cultural mentoring. There's the underlying assumption that individuals of one ethnic group or racial class may consider only having mentors in their self-identified groups. And that may not necessarily be the most advantageous, that it's important to have cross-cultural mentoring so that you learn from one another and gain access to the social networks and opportunities that others may have that you may not have previously considered or thought of. So successful mentors that support underrepresented minorities help by navigating institutional barriers, which we all know exist, facilitate a supportive environment that increases work satisfaction and decreases work-related stress. And so this can also be an example of being a sponsor for individuals to help them navigate the workplace. Characteristics of an ideal mentorship relationship include mutual respect, awareness of historical marginalization and barriers experienced by underrepresented minorities, appreciation of critical scholarship that focuses on the most marginalized and vulnerable populations, transmission of social capital, access to social networks or opportunities. Again, this kind of highlights cross-cultural mentorship, and investment in deciphering the unwritten rules of institutional culture, which we know very well exist. So these are some examples of mentoring models. Columbia University went into an extensive review of mentoring faculty at their institution, and from their working group, they developed a toolkit to help advance mentoring of underrepresented groups. And they came up with various models of mentoring. So you have the traditional model, peer and near peer review groups, group mentoring, mentoring networks, and then sponsorship. And you can see across the different categories what type of mentorship and what the components are. However, it was highlighted in their evaluation that there's no one single model fits all, and that the most successful models or mentee mentorship type relationship may employ a combination of strategies. And so this is something to keep in mind as well when you're working out your mentor-mentee relationships. And here for academic units implementing mentoring programs, it's very important to define what your program design will entail and your intended outcomes from the mentor as well as the mentee perspective. And this here just highlights some things to consider and to include in your package as you're developing your mentoring program in your unit. So when you're looking at your mentor-mentee, it's very important to define what your expected outcomes are as in terms of advancing knowledge, enhancing skill and professional development, and then also for the mentors, what they anticipate to get out of it, whether it be job satisfaction, increased collaboration, exposure to new ideas by engaging with others in their unit. So I'll close with this, and we'll have a time to discuss further with any additional questions in the Q&A section. Thank you.
Thank you, Dr. Mmeje. Our last speaker in the session is Dr. Jennifer Waljee, an associate professor in the section of plastic and reconstructive surgery and Department of Surgery, and co-director of the Michigan Opioid Prescribing and Engagement Network, MOPEN. And her clinical practice focuses on hand research, and her Research interest is currently in the areas of patient-reported outcomes and opioid reduction. Dr. Waljee.
I'm really excited to be here today. So I'm going to share with you some thoughts on what does diversity look like from the dimension of generation or age-related diversity. And so I think this is an important topic because increasingly in our workspaces, we're seeing individuals from 5 different generations working together. And so today we'll explore a little bit about what that means and what we can learn from that from the perspective of mentoring. So this is how it's technically defined. Generational diversity is a cohort group whose length approximates the span of a life and whose boundaries are fixed by peer personality. And what's really interesting about this definition is that it's not necessarily when you were born, but it's the events and experiences you had during that time. And so this definition is meant to be thought of at the macro level. It doesn't always necessarily trickle down to any individual because we all respond to our life events a little bit differently. It also may not be mutually exclusive, and it's most certainly dependent on culture, nationality, and geography. So generational diversity in the United States may look quite different in Japan or South Africa or other places, but what's really important to recognize about it is that it's an opportunity for us to understand the experiences of others, leverage that power, and then create harmony in our mentoring relationships. So here's a picture of one of my first mentors. This is my grandmother. She is a traditionalist. So the traditionalist cohort was born between 1927 and 1946. So their experiences were shaped by lean and stressful times such as the Great Depression, World War II, the polio epidemic. And traditionalists are characterized as loyal, strong, and frugal. These are my parents, they're baby boomers. The baby boomers were born between 1946 and 1964. And their childhood and early adulthood was shaped by the economic boom of the 1950s, but also unrest in the 1960s, where we saw the Vietnam War, the Civil Rights Movement, and other important influential events in our country, such as the assassination of leaders and the Cuban Missile Crisis. Here's Gen X. So this is one of my close mentors and collaborators, Mike Englesby. He and I both are in the Gen X cohort, born between 1965 and 1980. And our childhood was shaped by, again, the economic boom of the 1980s, the rise in technology. You can see that awesome cell phone that's there. And then also the expansion of women in the workforce. So that changed family structure in our country. Gen Xers are defined as independent, and they value autonomy in the workforce, and they're often self-sufficient. Here are some of my recent mentees who just graduated from medical school. They are in the millennial cohort. They were born between 1980 and 1995. And millennials in their childhood were shaped by the massive rise in technology in our country, the increasing diversity in our population, and then you can start to see some of the infiltration of violence that has occurred in the places where we live, work, and learn. Millennials are described as being achievement-oriented, team-oriented, family-centric, and certainly tech-savvy. And then this is the youngest generation. This is my daughter, Elise. She is in Generation Z. So my daughter has grown up in a world where there has always been the internet, and you don't have to watch a commercial if you don't want to. And with on-demand programming, you don't even have to have a show where there's any commercials. So Generation Z has been shaped by the influence of social media and, again, violence in the places where we live and work, and political division. They are described as being entrepreneurial and financially focused, also tech savvy, but they crave change, and most importantly, they crave interpersonal contact. So I think this concept of generational diversity is fascinating because if you have a one-on-one conversation with somebody, it wouldn't necessarily be polite to ask them, what is your age? But when you step back and think about these kind of macro characterizations of any of these cohorts, it's quite acceptable to express and have these implicit biases and these explicit biases in these groups. And it's not just necessarily the millennials, although that's shown here in the Time magazine cover, but it's also plays out for generation and generation and generation where they're malaligned, so to speak, by other generations. And so what does this mean for our mentoring relationships? So many of these misconceptions kind of fall in 3 buckets. First, the next generation is distracted, they're self-absorbed, and they're entitled. But I would argue that this quote here by George Orwell kind of puts this in perspective, that each generation imagines itself to be more intelligent than the one that went before it, and certainly wiser than the one that comes after it. So if we reshape the context by which we think about gender and age in our relationships, what does it really look like? Well, I would argue that the next generation is not necessarily distracted, but instead they're incredibly efficient, and they're able to harness the technology and resources around them to distill down information and accelerate their productivity in the workspace. I don't think they're self-absorbed at all. I think they're actually quite self-aware and self-actualizing, which allows them to connect with people at a much faster rate and accelerate their professional relationships much faster than previous generations. And I don't think that it means that the next generation is entitled either. I think, in fact, what they're looking for is engagement at work, and work that values purpose and meaning. So I conducted this highly unrigorous qualitative study where I asked my mentors who had been in practice for greater than 20 years, why did you choose academic practice and what do you love about it? And these are some of the representative quotes. And basically what plays out is that people value variety. They like being surgeons, educators, clinicians, researchers. They like the fact that they have a huge impact on their patients' lives, and that they also have a huge impact on teaching and training the next generation. So then I repeated the same exercise and asked people that had joined our faculty in the recent year, do they really value something different? Is this next generation different? And when you look at these representative quotes, they look exactly the same. People value variety, they want to make a difference in their patients' lives, and they want to train the next generation of surgeons. So in fact, it's not at all that the generations necessarily value anything different. I think it's the fact that our life experiences mean that that plays out in a different way. And sometimes that is what can lead to conflict. So I'll leave you with 3 strategies about how we can potentially manage this in our mentoring relationships. So the first is centered around efficiency, and Dr. Chopra alluded to this earlier, but I think these opportunities for micro-mentoring are critically important. So the traditional mentoring meetings often look like an hour-long meeting once a month or so with your mentor, but what we know from the next generation, from business-related research here, is that the next generation still values face-to-face contact, perhaps conflict too, just as much as the traditionalists do. So we have to be able to find ways to carve out time in our busy schedules to make those opportunities happen. So exactly as Vineet was alluding to, if you have these kind of small, more frequent meetings where you have very focused agendas or / micro mentoring, you can really accelerate your mentoring impact on your mentee. The next strategy is finding ways to engage our mentees. So again, in those kind of traditional mentoring meetings, we often assume that the information is going to flow in one direction. But there's a lot that our mentees and our mentors can learn from one another. So identifying opportunities for bi-directional mentoring, this is also called reverse mentoring or mentoring up, so that we specifically find ways to engage our mentees, give them opportunities to train us, I think will help both our insight and understanding kind of what the future holds, and also providing ways for our mentees to be more engaged with the larger purpose. And then finally, the strategy around team-based mentoring that Dr. Saint was alluding to earlier. Again, I think this is really valuable so that we can bring people to the table, celebrate their different perspectives, and harness the power of cognitive diversity and balance these perspectives so that we have harmony in our mentoring relationships. Thank you very much. I'm very glad to be here.
Excellent. So we've heard a lot of great perspectives here. We heard from Dr. Moniz some of the challenges of facing gender bias in the workforce and how mentorship can be an important strategy to combat that, as well as some concrete strategies. We heard from Dr. Mmeje the importance of the profound importance of mentorship in improving workplace diversity and making sure everybody advances in an inclusive way. And we heard from Dr. Waljee putting a very positive lens on differences and how we can harness those differences and change our lens to make sure we're affecting across generations in an effective way. So with those perspectives, why don't we engage you all in some discussion? Do I have anybody willing to ask a question? Gurjeet. All right there. That's a long way to throw, but for you, yes.
Thank you for that inspiring talk. It hit on many levels. You have me thinking about a program in the Department of Surgery that John Finks started, Doctors of Tomorrow, which is a mentoring program between med students and high school students at Cass Technical School in Detroit. And more than, I'm going to estimate, each year is probably 60 to 70% of that cohort in that high school are women from racialized backgrounds who are Gen Z. What else could you add to this discussion about mentoring at that intersection?
Thank you for that question. I think some of the recurrent themes that I've heard in our conversations and in our talks today are really about communication, assuming the best about the person in front of you, and seeking first to understand. So lots of asking questions and understanding that a behavior that you might strike you as odd, or why would they say that, or why would they email this way, or this seems inappropriate, to take a step back and think about, is this coming from a place of, as Dr. Vaughn mentioned earlier, a lack of confidence, or a fear of appearing unprepared or not as competent as one would like to be. And so I think bringing a sense of generosity and compassion is so critical when working with somebody who has a totally different lived experience, both in the world as well as in the workplace.
Thank you. I'm familiar with that program, and I know some individuals who participated in it. And I think that it would be really advantageous in that circumstance to consider the cross-cultural exchange, where I know the medical students tend to go to Cass Tech and engage the students there. I think it may also be beneficial to understand, as Michelle was highlighting, their surrounding community and the opportunities that may present themselves there locally, and then also allow the students to have the opportunity to come to Ann Arbor and see what opportunities rest in this area. And I know the big goal of the program is to have the students particularly matriculate to the University of Michigan here. So I think that offering that cross-cultural exchange would foster understanding of different individuals, in addition to offering that mentorship and support that they need to advance.
Why don't you go first since you're closer, and then you can lob it over to him next.
Sure, I'll try to, Bob. Okay. Hi, I'm Martin Boyan from the Department of Family Medicine. I'm Director of Faculty Development in the department. And in that role, I get a chance to have a one-on-one discussions a lot with the clinical track junior faculty. And we have a lot of women in our department. And the issue that keeps coming up is time management. And one big white elephant that I see, big elephant in there, is when we talk about time management, we also have to talk about not just in work, but also at home. And there's disproportionate amount that women do. And I get that. Whenever I talk to them, I kind of get that sense. But at the same time, I'm thinking I can't say, well, tell your husband to shape up, But, I'm kind of trying to figure out a boundary of, as a mentor, where do I kind of focus my recommendations and advice regarding this time management, because the reality is it's different. Based on gender, I think the women disproportionately have to deal with more stuff, not just outside of work. And how do you deal with that, especially when I'm a guy? And and so I may not be able to really appreciate the challenges that they face.
Firstly, I appreciate the humility that you bring in asking that question. I don't think there's a magic bullet solution. Two immediate thoughts I have are talking openly about the challenges that brings and thinking about strategies that might help to reduce burden at home. So, as a physician, might you be able to partition some of your income to hiring a housekeeper or somebody to cook dinner once a week so that those activities don't fall on one person to take care of. I think also protecting your mentee from that same kind of housekeeping chores at work is really important. So not allowing your mentee to be doing, all of the teaching activities, all of the service activities, all of the volunteering that isn't really getting her credit towards promotion. in the way that she wants to be promoted. Of course, if she's passionate about those activities, you want to encourage her to do them, but I think trying to make sure she's not also being disproportionately burdened by those kind of thankless tasks at work is another important strategy.
To add to that, I think that it's important to find out what the end user, so your junior faculty that are women, what it is, that they actually need. So if they have the opportunity to share with you what they need, I think that's kind of the starting framework. And in some situations, and I know in our department, we've talked about, scheduling of meetings, what are best times to do that, if we should even consider bringing in child support, like having someone come in to watch, children. Sometimes we have meetings that are after hours and daycare is closed, you know what I mean? And so how do we support our faculty in those circumstances? And then also providing the appropriate support staff within the department. Sometimes we can have high-level administrative assistants that can take on some of these other tasks that some faculty may be assigned to do, and then that shifts their attention and the burden in other ways.
And I think all these points are fantastic. It seems like this issue of work-life balance is kind of an everyone issue as we figure out how to manage our complex lives, whether it's an ill family member or an aging parent or a child. And so perhaps it brings this kind of holistic view of mentorship and trying to understand, as much as a mentee might be wanting to share that, kind of what are their other life pressures that are going on with them. And I was encouraged by some of the comments earlier around peer mentoring groups. I think that might be a great opportunity, or perhaps finding like other individuals who could serve as a coach for those specific issues. This is somebody who's been successful in managing it. Perhaps having a cup of coffee or a lunch to give them some practical strategies for how they can balance these work-life issues that are so common for all of us.
All right, I think we have time for one more quick question.
Okay, try to make it quick. Bob Dixon from Internal Medicine, Pulmonary and Critical Care. Thanks for your talks. I imagine we're all convinced that effective mentorship is a powerful tool for advancing diversity and inclusion, but I keep thinking about a question asked earlier of how do you get a trainee plugged into a mentor-mentee relationship in the first place? And specifically, Vineet's answer to the question earlier, which was close to home for me, which is when a candidate comes to you, you give them a task. You give them a modest hurdle to clear to sort of prove their engagement and their interest. And that's something that I do. I think it's fairly common. And what worries me is, could that practice be unintentionally disadvantaging mentees or trainees who kind of don't know the rules of the game? I imagine if you come from a family of academics, you probably know you're being auditioned. In my experience, some trainees don't realize that. They don't even know that they're being asked to perform to prove themselves. So I wonder if you could comment on that practice specifically, and more generally, how do we get trainees plugged into these relationships in the first place?
Sure, I can tackle that question. I don't know if I have any solutions, but I've had a similar experience where we've tried to implement launch team mentoring programs in our department, and I have been struck by how easily it is to construct a launch team based on kind of your own social networks and the people that you know. And so being mindful of the broader community that we have and continuing to be aware of that and ask yourself that question, am I setting this person up for success, or do I have blind spots around mentoring? And I think perhaps going back to some of the earlier comments about really clear, frank communication, so that people understand, hey, I expect an email in a couple of weeks, please summarize these points, is really helpful, so that then there's kind of no assumptions about what the expectations are.
Yeah, I would just add to that, in addition to setting those clear expectations, that this is a way that I figure out who I want to work with. And so making that very clear for people. And I think also recognizing something that Dr. Mmeje mentioned in her talk, that particularly for underrepresented minority groups, these individuals may have gone through much of their professional career thus far on their own without a lot of mentorship and help. And so making it very clear that it is okay to ask for help. If you're struggling with this, please reach out to me. I want to meet with you again. And kind of setting them up for success, I think, is really critical.
Yeah, excellent question and great answers. So why don't we thank our panelists for this, and we'll move on to the next.